spend a lot of time talking about prescription drug management. Well, today in our take, we will spend time addressing over-the-counter medication. Hi, Shannon DeConda with NAMUS. Today's question was submitted to me by Kelly, and Kelly does work in a dermatology practice, but let me tell you, it doesn't matter what specialty Kelly is in because her question is relevant no matter what your specialty is. So here's specifically Kelly's question. It has to do with off-label use of an over-the-counter medication. We have a physician who states that they are using an over-the-counter medication at a higher than OTC dose. For example, they are treating a patient with urticaria, and I tell them to take 2 to 3 Allegra at night plus Benadryl. Oh my, I don't think I'd wake up the next morning. I can't hardly sleep with one. I wake up with one Benadryl. Anyway, the point is this is not a normal dosing that a patient would use these types of over-the-counter medication. And the physician is stating, I should get credit for this encounter as if this is prescription drug management. And of course, the auditor is stating these are not prescription drugs and you are not using prescriptive authority. Therefore, I cannot rule these as prescription drug management. I have to say, time out. Remember that the third column of medical decision making, we are not scoring the treatment plans, everyone. Remember what the header of column 3 says. The header of column 3 says it is the risk of complications of the patient management or treatment that is rendered or is being considered for that patient. So my question to the physician is, what I really need to see is the documentation and how the risks, what are the risks for this patient in taking that type of a dose off brand for this patient. That is not an FDA approved dose. So I would expect that the documentation would mimic that is the case. So what are you documenting that are the impending risks for this patient? So my presumption as a non-clinician would be based on if you're familiar with the MDM charts that NAMUS has created for auditors that include lay terms and additional guidance that are available on our website or in our shopping cart. And they're free downloads, whether you get them on our website or in our shopping cart. But these show for you that these risks are average, below average, above average. When we consider the risk of a patient using an over-the-counter medication off-label, that would certainly not be low or below average risk. That would be at least average risk of a typical encounter, equivalent with what this provider is saying. The thing is we can't get locked into these examples that the AMA has given us, which is prescription drug management, decision for surgery. Remember, those are examples only. And the reason they're examples only is because this category is the risk of managing those patients. The risk of managing that patient is this is off-label management, which is a higher level of risk than managing a patient on straight over-the-counter treatment. And for that reason, if documented appropriately to validate such risk, it would be a higher level of care. So remember, when considering the third risk, we are always considering the risk. And our providers need to understand when documenting the treatment plan, it is not just documenting the treatment plan. It is called assessment and plan, But nowadays, we should really be calling it the evaluation of risk and treatment. Realistically, that's what we should be calling this area for our providers to help them to better understand what should be included in the documentation. I hope this segment has been helpful for you. Please make sure you're checking out the agenda coming up for our virtual conference and more on our website. Thank you. Don't forget, if I can help you with any questions or comments, check me out on LinkedIn or on our website. Hope you have a great day.